Physiotherapy, why is it important for patients with a musculoskeletal condition? Why is physiotherapy important? This question is asked most often by those suffering from movement-impairing conditions such as cerebral palsy, multiple sclerosis, Parkinson's disease or spinal muscular atrophy. These patients' mobility is severely affected, they are unable to walk, move around or take part in their usual daily activities. Physiotherapists assess the patient's condition and accordingly recommend physical therapy and/or surgery. While physiotherapy can help restore movement to these patients, it should not be considered a cure. Rather, it is an avenue for improvement. And the aim of physiotherapy is to help regain the ability to move normally. Physiotherapy helps restore movement in the treated area. In some cases, the therapy includes physical rehabilitation. One important goal is to increase the patient's functional independence. One technique is to position the patient so that he or she can stand, walk or sit up. As well, one-to-one physiotherapists should keep track of the progress of each patient throughout the course of treatment. A physiotherapist can use various techniques to improve the patient's mobility. One such technique is manual resistance training. One of the benefits of this type of training is that it can improve strength, balance, endurance and overall health. Using devices such as weights, wheels, medicine balls and ankle weights can also assist with improving mobility. Devices such as electric knee splints can also help restore the patient's mobility, as well as provide traction for improved stability. For some patients, physical therapy can include physiotherapy designed to correct poor muscle tone or tightness. These are known as focal treatments. Other physical therapy can involve rehabilitation of the injured area, movement of the joints in the affected region and correction of abnormal function. These are known as massage therapies. Why is physiotherapy important in rehabilitation? Physiotherapists perform a variety of tasks during physiotherapy, including recruiting muscle strength, stabilizing and increasing flexibility. They also instruct patients on how to modify their daily activities to promote improvement in their condition. Some physiotherapy assistants also perform basic tasks such as feeding liquid formulas to patients, removing sutures and checking vital signs. Why is physical therapy important in the treatment of individuals with neuromuscular conditions, like multiple sclerosis, Parkinson's disease, stroke and spinal injuries? Typically, neuromuscular conditions affect one or more muscles at a time, making it difficult for an individual to move. A neuromuscular condition can result in difficulty walking, balancing or climbing stairs, walking without feeling the usual burning sensation in the legs. When individuals with neuromuscular conditions do not get the appropriate exercise, their level of physical functioning can decline to the point where they need assistance with daily activities. How is it performed? In most cases, one or more physiotherapists is assigned to a patient with a neuromuscular condition, often coordinating the treatment with teaching physical therapy. Each physiotherapist is trained in one or a blend of techniques to achieve maximum results for their patients. They use a variety of methods such as manual resistance training, electrical stimulation, ultrasound, laser, and various combinations. Many physical therapy specialists also perform one-on-one sessions with their patients, allowing them to directly address the needs of their patients and learn new techniques that can help them improve their function and level of mobility. As noted above, neuromuscular conditions generally require that physiotherapists apply one or more techniques known as interventions. Examples of these interventions include electrical muscle stimulation, EMS, ultrasound, manual stimulation, as well as rehabilitation. While these techniques are often applied together, some therapists allow their patients to perform one or more at a time. This allows for a higher rate of functional improvement, but it may be necessary to have additional surgeries, injections, or other therapeutic devices to fully treat a patient's condition. Stimulation, ultrasound, laser, and various combinations. Many physical therapy specialists also perform one-on-one sessions with their patients, allowing them to directly address the needs of their patients and learn new techniques that can help them improve their function and level of mobility. As noted above, neuromuscular conditions generally require that physiotherapists apply one or more at a time. This allows for a higher rate of functional improvement, but it may be necessary.